What determines the life of your knee joint? Removing the meniscus almost always leads to future osteoarthritis. If you neglect your knees and never strengthen the muscles around the joint, a painful and difficult old age becomes inevitable. Limited movement, stiffness, limping. If you want to heal your knee, you need patience, regular exercises, discipline, and proper muscle work. That's the only real path to recovery. The function and longevity of the knee joint depend entirely on the muscles surrounding it. And most knee pain comes from a displaced meniscus, usually because the ligaments that stabilize it have weakened.
Causes of knee pain. More and more people today, not only older adults, but even young individuals, suffer from knee pain. Why? I often say, a person ages with their legs, not with their years. I see older people barely moving their feet, not because they are old, but because they never took care of the muscles in their legs. Their knees were simply used, not maintained, not trained. If you ignore the muscles that nourish and stabilize the knee, you are guaranteed a painful and limited old age.
Do chondroprotectors, creams, and injections help? Many people use ointments and chondroprotectors because doctors prescribe them or because advertising convinces them they work. But the knee joint consists of muscles, ligaments, and synovial fluid. Synovial fluid is produced only when the muscles are active. No cream can penetrate inside the joint. There are no blood vessels inside cartilage. The same applies to chondroprotectors and expensive miracle injections. It's business, not treatment.
Knee osteoarthritis. Osteoarthritis is extremely common. Doctors often prescribe ointments, pills, and intra-articular injections, but they're pointless. Why? Because cartilage and bone have no blood vessels, meaning medications cannot reach them. Only one thing works: exercises that strengthen the muscles and ligaments around the knee. What exactly you can do depends on meniscus condition, ligament injuries, Baker's cyst, and other structural problems. The specialists who truly treat joints are kinesiotherapists, especially those working with the Bubnovsky method. What to do with a meniscus injury? Most doctors immediately suggest surgery, but removing the meniscus almost always leads to osteoarthritis. It's just a matter of time. The meniscus is a shock absorber, similar to an intervertebral disc. It wears out, becomes thinner, or can shift if the ligaments weaken. Surgery is truly needed only in one situation: when a torn piece of meniscus gets stuck in the joint and the knee cannot bend or straighten. In all other cases, you must restore ligaments and muscles, not rush to surgery.
Should you replace the knee? Knee replacement, or endoprosthesis, is done when the joint is completely destroyed and cannot be restored. But before the operation, the muscles and ligaments must be prepared. If not, rehabilitation becomes extremely difficult. Most people over 60 go to surgery with severely weakened muscles, which is why recovery is slow and painful. The surgeon replaces the joint, but muscles are your responsibility. I've seen patients, even women in their 80s, fully restore their joints without surgery, simply by training consistently. The key is patience and dedication.
Knee pain? What to do right now? The quickest way to reduce pain is a cold compress with ice. It decreases inflammation and swelling. At the same time, you must start doing simple movements. Even very light exercises activate the muscles and improve circulation, helping the swelling go down. When the muscles work, they create natural drainage. The fluid leaves the joint and the pain decreases. The best tool for this is the Bubnovsky MTB trainer. It provides controlled load without compressing the joint.
How long does recovery take? It depends on the individual. There is a special table of functional norms, weight, repetitions, strength levels. You're considered recovered when you meet these standards. Some reach this in 2 weeks, some in a month, others in a year. It depends entirely on consistency and discipline. Knee pain develops over years. You cannot fix years of degeneration in a few days.
Where to go if you wake up with knee pain? If you wake up with sharp pain, apply ice for 20 to 30 seconds. Perform a few simple exercises. If walking is painful, use crutches temporarily to unload the joint. It's not weakness, it's rehabilitation.
A universal exercise program. Yes, such a program exists. In my book, Knees Hurt, you can find 10 to 12 effective exercises you can do at home using elastic bands. However, full recovery without supervision is difficult. Professional guidance is highly recommended.
How to prevent knee pain. The main idea is simple. A person ages through their legs. When the leg muscles weaken, all joints begin to collapse, knees, hips, and even the spine. To avoid this, train your legs 2 to 3 times per week. Strengthen your muscles regularly. Never ignore early discomfort. If you don't want osteoarthritis, surgery, or a knee replacement, take care of your legs now, throughout your life.